Hello, everyone. Good evening, good afternoon, good morning from wherever you are watching me from. My name is Olushola Oyelami. I have been a registered nurse since 2011. I graduated then with an associate degree in nursing, and I got my bachelor's in 2014, and I got my master's in nursing with emphasis in public health in 2019. I started my nursing career working with people that have some physical and intellectual disability. These categories of people were so fun then to work with, and once in a while when I come across of them, they are still so fun to work with, trust me. Those categories of people were always making my days when I was working with them. I work at one of the county jails in Houston Metropolitan, a little less than 2 years. There, I learned to be more patient and to be more disciplined, because not everyone in the jail is a hardened criminal, not at all. Note, the law regarded everyone in the jail as criminals, but in reality, some people got to the jail just for some reasons that they never thought could land them in the jail. Some got into the jail due to spousal violence. Husband beating up his wife, wife beating up her husband, boyfriend slapping girlfriends, girlfriends slapping boyfriends. Some people landed in the jail because of that. Some other categories of people are in the jail due to unpaid ticket fine. Trust me, in the US, if a police officer stops you for one reason or the other and they give you a ticket, we call it a ticket. It is a ticket, like a fine. They give you a designated period of time for the ticket to be paid, or you can either go to the court to dispute it. If you don't do either of these two things, not paying your ticket or not disputing it in front of a judge in a court, if they rearrest you, maybe later in future, you can be put into jail because of that. Some people are in the jail due to the reasons of driving while under the influence of alcohol. Yes, in the US, if you drink, get drunk, and you drive, if the police officer stops you, you're gonna go to the jail. So if you want to drive, you better don't get drunk. If you want to be drunk, you better hide your key. Hide your car key somewhere and don't drive. Of course, some others are in the jail because they are hardened criminals. I don't want to go into details of that today, maybe in future. In continuation, I started off as a bedside nurse back in May of 2016. I was a bedside nurse providing direct care to patients. Of course, we all know that if you are not sick, you cannot be admitted into the hospital. Some people are really so sick, when they admit them, they cannot do anything for themselves. Some people cannot even get out of bed to go to the bathroom. Yes, I was one of the luckiest nurses taking good care of that categories of patients while I was working in an IMU, intermediate care unit. I was providing direct care, giving medication, helping patients to the bathroom, getting them up to use bedside commode. Some can at least maybe use the bedside commode, but they cannot clean themselves. So as a direct care nurse, you wipe them off. We take the bedside commode or the pan, bed pan. We call it bed pan. The bed pan, we clean the bed pan and dry it off after the patient has finished using it, and maybe save it for another time the patient will be needing it. Some can get up, but they will need some assistance, to walk from the bed to the bathroom, to either go pee or to go poo. And as a bedside nurse, I was doing all of this, happy doing what I was hired to do, because I choose to be a nurse and I love to care for people. So as a bedside nurse then, I was proud of myself, and I'm still very proud of myself. And I'm proud of all the nurses out there taking good care of their patients. Kudos to you. Continue doing the good job you've been doing. I learned a lot about working. I learned a lot about life, working at a bedside, seeing how people, family members, friends, even nurses, showing love to patients and to their loved ones. Remember, people treat people differently, depending on what? On their status. Social status, economical status, mental status, and of course, financial status. But as a nurse, you provide care to everybody, equally. You treat people as you would want to be treated. It could be you or your family member that will be the next patient in the hospital bed. So I was always treating my patients equally. I treat them with care, with love. I show empathy. And like I said, I was happy doing what I was doing then. And I'm still very happy as a nurse. Guess what? I also learned that life can be too short, especially when the COVID hit. COVID hit really bad and claimed so many lives, not only in the US, but all over the world. Many lives were cut off, were taken away within a short time by COVID. Guess what? I became more humbled. If I say humble, I really mean it, since after COVID. Because why? It could be anybody's turn tomorrow to be gone. Those people who lost their life to COVID never ever imagined that it was going to be their time then. Because some of them never even felt sick. Some slept, they never woke up. Some drove to the hospital, they never, they ended up in the morgue. So I became more humble, and I'm still very humble, and I'm gonna continue to be humble. I started a role of a patient educator on August 29th of 2021. And I'm still working as a nurse, as a patient educator till today. As a patient educator, I teach people about what? About how to better manage their chronic diseases. Such chronic disease as high blood pressure, high cholesterol, and high blood sugar, which is referred to as diabetes. Diabetes, of course, is a big one. I'm not gonna, talk about diabetes today, but I'm planning to go into details of diabetes care maybe in the future time. But know that if you have diabetes, you're gonna have to take good care of yourself. It needs a better management. It means, some lifestyle modification. You cannot have diabetes and not being taking medication. You cannot have high blood pressure and not taking, blood pressure medication. So also cholesterol. Many a times people think that once they take their blood pressure medication or diabetes medication for 2-3 months, if their numbers go down, they think that is it. They don't want to take their medication again. No. Blood pressure medication and diabetes medication are both lifelong medication. If you stop taking your medication, these two chronic diseases will come back. Guess what? They don't go nowhere. And that is why they are tagged chronic disease. So chronic disease is a disease that you have to be managing, for the rest of your life. Diabetes, high blood pressure, high cholesterol need, real and strict lifestyle modification to manage them. I've made this introduction today for 2 reasons. Number 1, to jumpstart my YouTube channel. And number 2 is because I just passed my certification exam for diabetes care and education specialist yesterday. Yesterday, 4th of April, 2024, I became a certified diabetes educator. Yeah. I'm so happy. If I tell you that I'm happy, I'm really happy. It wasn't, an easy journey for me to reach where I am today. I've always loved to be a diabetes educator, and this reason, I'm gonna let you know why in my next video. Diabetes is a chronic disease. It requires a lifelong management. If you have diabetes, don't play with it. Take your medication, take care of yourself, watch what you eat, monitor your blood sugar, and I'm gonna be talking to you in my next video in a few days from today. Thank you for watching. Watch, and share it with people. This is all about me, Olushola Oyelami. I go by Shola, S-O-L-A. The Americans call me Sola. Some people call me Sola. And some Hispanic call me Solo. Some people call me Olusola, Olushola, Olusula. Whatever you can call me, feel free to call me. Again, Olushola is my name. Thank you for watching my YouTube channel. Talk to you later. Bye.